Hello friends, my name is Sajjad Pathan, and through this video today we shall be talking to you about how does one get onto the specialist register in the UK. There are many different training pathways. For example, you can go through the ACCS run through, or you can adapt the dream pathway for your registration and completion of your training. However, it's a lengthy process and a very systematically organized process. For those who are interested in knowing more about the training programs, please put in your comments below. And what I would do is I will try to get one of my colleagues who's into training at the moment to make a video for you all. This video is exclusively about obtaining your GMC specialist registration through the CESR pathway. So what exactly is CESR? CESR is Certificate of Eligibility for Specialty Registration. That means the GMC is going to compare your level of training with that of a UK trained professional and then assess whether you are at par or your training is at par for the training within the UK, and then put you onto the specialist register. It's not that easy as it sounds. However, my strong feeling will be, if you are going to come to the UK and want to work as a specialist, I would rather recommend you guys to go through the normal conventional training pathways. However, some of us would still want to persevere because we had ample years of experience back home and want to use it as an evidence to provide your equivalence to the GMC program. What you need to do right now is to begin the process right away where you are working. Try to gather evidence for whatever you do in your department. Whether you see patients, you make a note of it, keep a log of the cases, what you see, what kind of meetings you attend, and what you contributed in that meeting, and a reflection of those meetings. Plus, evidences should be usually within the last 5 years of your application. So if you're going to come around over here and think about getting into the CESR within next 3 to 4 years time, so you will not need evidence dating 1 year back, more than 1 year back. So in the last 1 year or so, if you have collected those evidence, that would be useful. Evidences, you can compare the curriculum of the college. You should remember the college curriculum is about to change the next year. So your evidences should match the new curriculum rather than the old curriculum. So get a copy of the curriculum at rcemcurriculum.ac.uk. I'll post a link in the discussion below, and then you can follow it up over there. Go through the curriculum, see what kind of competencies are needed. However, that curriculum is still not enacted yet in the UK while we are speaking. Under normal situation, as per the old curriculum, what evidence they need is that you have done the ACCS modules of those competencies, like case-based discussions, mini cases, practical procedures, DOPS, which is direct observation of procedural skills, 3 months of rotations in acute medicine, and there are various competencies to be obtained in there. 3 months of rotations at least in anesthesia, and various competencies in there. 3 months in pediatric department, or it can be split up in the peds and the peds emergency department. Apart from that, there are various parts like practical procedures and EM competencies which will be needed as a part of your ACCS curriculum. Then comes the higher specialty curriculum, where we need further elaborated case discussions and difficult cases, evidence for those. And then what they need is, how have you contributed in the management of the department, whether you have responded to complaints and grievances, whether you have investigated a serious incident, whether you have written a letter to the coroner, whether you have written a letter for the police, and so on and so forth. You have arranged a training program. So all those things will be as a part of your management portfolio. There should be at least 2 cycles of audit loop completed and the learning obtained from that. or a quality improvement project which you have designed for the department, and the cycles through which you have gone through. Apart from these are your Fellowship Royal College of Emergency Medicine exams. While I'm making these videos, the exams are likely to be changed from next year. So you might be benefiting by visiting the curriculum website where it says how the curriculum will be assessed. We are moving away from the SAQ pattern to the single best answer. Certain parts of the examination are going to be tested locally, whereas certain parts of the examination will be removed as from compared to the old version of the exams. If you have done some publications, you can put that as well as an evidence for your qualification. What kind of workplace-based assessments are needed? As I have said already, what you need is your ACCS competencies, your higher specialty competencies, emergency medicine, ultrasound, which is your level 1, level 2, and level 1 certification, and some extended supervised learning events within the department. When we come to the secondments, as I said earlier, you need 3 months of acute medicine, 3 months of anesthesia, 3 months of intensive care unit, and 3 months of pediatrics. In the audit part, as I said, you need 2 complete loops of an audit process and the learning from it that can be replaced with the quality improvement project, which in itself will have audits done. Next, most important thing is your CV. The guidance for making a CV has been given on the GMC website. The CV should be as per that guidance and should be at least 15 to 20 pages long. The log of your work experience and your other achievements should be maintained as per the guidance given on the GMC website. If your hospital does annual appraisals, a report of those appraisals will be very essential because the GMC for its CESR will need your appraisals for the last 5 years. Then, after you accumulate all these evidences, including your workplace-based assessments, your CV, your administrative things, your QIP and publications, all these things are evidence are accumulated, you need to sit down with your reviewer. The reviewer should ideally be your clinical director. With the reviewer, you need to go through each document. Once everything is accumulated, you need to submit a scanned version of all these documents to the GMC along with at least 4 referees. You need to submit this application on GMC Online. Send an email copy of your CV to the referees and tell them what will be expected. You will need, after submission, you will need to follow it up with them, because how the process works, as per my understanding, is once you make the payment of £1,680, yeah, it's too much, you need to wait for the GMC to send your CV or your forms to the referees. You need to be behind the referees to get it sorted as soon as possible. Once the referees submit a report to the GMC will pass on the application to the members of the Royal College, which will go through your application and see if it is deemed equivalent to that of training in the UK. And once it is successful, you're put on the specialist register. If you are unsuccessful, there is a policy to appeal. You can appeal against the application result, or you will get a feedback on what are the deficiencies, which if you complete in the second attempt, you will be successful. That's all for now. If you have any questions or comments, please share this video, press that subscribe button, and I'm coming up with a new video series on emergency medicine. Watch out for this space and this channel. Thank you.